Dr. Rooma Sinha, robotic and laparoscopic surgeon at Apollo Hospital, Hyderabad. I fell in love with surgery in my third year MBBS at Institute of Medical Sciences, BHU, which later figured out as my distinction in surgery in my final MBBS. All geared up to take surgery as my career, but lo and behold, with societal and peer pressure, when there was a time to choose my post-graduation subject, I literally got pushed into choosing obstetrics and gynecology. Not the happiest person, but I joined obstetrics and gynecology thinking this is my destiny. Very soon during my training, I realized I can do what I love. There is so much of gynecological surgery to be done as an obstetrician and gynecologist. And there began my journey of minimal access surgery. I was fortunate to be practicing in 1996 at Hyderabad in a hospital which had the infrastructure and the expertise to do laparoscopic surgery. I picked it up, started doing one by one. We had no mentors. At that time, it was an uphill task. There was a handful of gynecologists who were doing their own gynecological surgeries. It was mainly the surgeons, the male, and it was a male bastion. Most people thought women can't do surgery. Most patients thought there has to be a male in the operating room to do my surgery. Well, it was a hard work, but we reached at a point where I thought I was a fairly accomplished laparoscopic surgeon. Doing most of my work laparoscopically. I was pretty happy for myself. Well, in 2012, then I was introduced to a new technology, and that's robotic surgery. And I thought, what is this? Should I get into this? But my gut feeling told at that time that this is the future. That is the advancement in laparoscopy that you are looking for, Rooma, and that will what will take you further. It was again a big turning point in my career. It was difficult to pick it up again because I was literally the pioneer in doing robotic surgery in India. There were nobody to teach me. We had to learn from our colleagues. And it was not also without a bit of ridicule and some kind of pushback from other colleagues who literally nicknamed me Rooma Robot in my hospital. I persisted by the Japanese philosophy of gamma, which means persistence, perseverance and patience gives the results. And 11 or 12 years down the line, the rest is history. Today, with my expertise in benign gynecology and robotic surgery, I teach not only in this country, but I go to various countries as mentor, as a faculty, as a teacher to teach robotic surgery to young gynecologists, which is probably one of the most happiest thing that I do today in my career. I've also established the Association of Gynecological Robotic Surgeons of India 2 years back, which dedicated to teach robotic surgery only to gynecologists. And further to this, just got elected as the President-elect for the Asian Society of Gynecological Surgeons. So I'm very glad that I left obstetrics behind, which was again a real no-no for a gynecologist, that how would you survive? Where will the patients come if you don't look for pregnancy patients? But I left that because I wanted to focus myself completely on gynecology. Bringing smiles on my patients' lips is something that brings smile to my face as well. But remember that in your hard career, nothing can be achieved without your friends, colleagues, well-wisher, a good team, and overall a supportive family, which I found in my husband and my daughter. Thank you.